President-elect Joe Biden says he will release nearly all of the available doses of the coronavirus vaccine when he takes office later this month. It's part of an effort to speed up the slow-moving vaccine rollout. To date, just 6 million people have gotten shots. The announcement comes as coronavirus cases surge across the U.S. More than 283,000 new infections were reported on Friday. More than 3,500 people died. That is, luckily, down from Thursday's single-day high, but it's still not good. CBS Tom Hansen reports.
The number of people who received their first vaccination doubled this week, 6 million as of Friday, a number, though, that pales in comparison to the number of people sick and suffering. Ofelia Reynoso says she was so careful she never expected to be gasping for breath, laboring each word. Yet she's lucky. Hospital beds are in short supply in Los Angeles, where she's being treated. And nationally, a record 4,000 deaths were reported on Thursday.
It is going to get much worse before it gets better.
Mobile mortuaries have already set up outside hospitals in Los Angeles, where a person dies every 8 minutes. Even as military teams are now helping some overwhelmed hospitals, LA's mayor is concerned that care will have to be rationed.
If you can spare a doctor or a nurse, if you can spare anything, please send it here. We're Americans.
California is one of at least 8 states where the highly contagious variant of the virus has been detected. But the makers of the vaccines, Pfizer and Moderna, report they're confident their vaccines will also protect against the new strain.
Hey there, Lana. Well, New York City is trying to find ways to speed up vaccine distribution here, which has so far fallen short. With sites like this one, an additional 3 million New Yorkers, including the elderly and essential workers, will be able to get the shot as soon as Monday.
Want to see that happen. Thank you, Tom. To talk more about the crisis in California, I'd like to bring in Dr. Nicole Van Groningen from Cedars-Sinai Medical Center. Doctor, thank you so much for the work that you do, and thank you for joining us today. So I'm grateful because you're a doctor in the LA area, and we have heard really horrific accounts of morgues overflowing, hospitals unable to secure adequate beds for their number of patients. How much of that is a reality, and how much of that are you actually seeing as a doctor?
You know, the reality is we are seeing patient numbers like we've never seen throughout this entire pandemic. Here at Cedars-Sinai, we are full. You know, our traditional ICU capacity is completely filled, and we've had to get creative with space and staffing to make room for all the patients that are coming in and needing our help. So it is very much a reality at every single hospital in this region. We are all struggling to keep up with the surge that we're seeing, and unfortunately, we only expect it to get worse.
Well, California is one of 8 states seeing cases of the highly contagious variant from the UK. What are your concerns given the current situation that your state is already dealing with, and now reports that a more contagious strain is there and spreading throughout the United States?
So what we know about this new variant is that it is more contagious than the original version of the coronavirus because it has this mutation that makes it a little bit extra sticky. It can stick to human cells a little bit better and infect people easier. What we know is reassuring, however, is that it is still targeted by the vaccine that we are currently administering to all our staff. And we do not see any evidence that it is more deadly. So those are 2 reassuring things. But it is concerning to me that we have this more infectious variant of the virus at a time where we're already seeing a surge from so many factors, you know, from holiday travel, holiday gatherings, just the cooler weather, and people honestly loosening up on their social distancing and all the other guidelines that we've suggested. So it's not ideal timing. We are concerned about this. It's just one other thing that we're concerned about. But we hope to be able to convince people to do the right thing as much as possible, to stay home, to avoid gathering, so that our cases can be kept to a safe level.
Well, you mentioned the vaccine. What do you believe needs to be done to get as many people vaccinated as possible? I think a lot of people are still shaking their heads knowing that that so much of the vaccine is just sitting in refrigerators right now.
Yeah, you're exactly right. You know, California has received about 2 million doses of the vaccine. About a third of those have actually ended up in people's arms. So a lot of people are looking to those numbers and saying, we need to do a lot better. Our governor, Gavin Newsom, has said we need to do a lot better. And actually, he set out a goal that we will vaccinate another 1 million people in the next 10 days, which is incredibly lofty goal. But I think it needs to get done. We have had some logistical challenges. Part of that is because this isn't just like a flu vaccine where it's come one, come all. We need to make sure that we are prioritizing the people who are at highest risk of contracting the virus and who are at highest risk of dying, so that people can't just skip the line if they're not in one of these high risk groups. But it's incredibly challenging. And the bottom line is, we just need to do this faster so that we can start seeing the benefits of this vaccine, start seeing it make a difference in the state of our pandemic, especially in the Southern California area where we're struggling so much.
Well, along the lines of getting people vaccinated faster, as you say, President-elect Joe Biden announced his plans to release all of the remaining doses of the vaccine when he takes office. This veers from the Trump administration's plan to keep half of the doses. The reason for that, for our viewers, I know you know, but it's to ensure that there's enough for people to receive their second shot of the vaccine. What I'm curious from your perspective, Doctor, is your area. They're in your area. Is the problem really a lack of vaccine or a lack of resources to actually distribute it?
It's definitely the lack of resources to be able to distribute it. Like I said, California has received a couple million doses of a vaccine. We've only been able to get about a third of those doses into people's arms. And so we need to loosen up some of the restrictions about who can provide these vaccines. We need to get a little bit more creative with who we're enlisting to help out with this and when they're enlisting to help out with this. And those are the sort of roadblocks that our state health department and our governor are working towards reframing so that we can get these available vaccines inside people's arms faster.
One last question for you. Elected leaders from across California, including Congressman Tom McClintock, are actually meeting this weekend for the Reopen Cal Now conference. They're discussing ways to reopen your state, saying that it can be done safely. How do you feel about that?
You know, we have been in the thick of this for 10 months. What we're seeing now is the worst by far that we have ever seen. And so my view is that we need to do everything we can to stay apart from each other, to stay in our own homes, to avoid gathering with people, because it's life or death at this point. Our hospitals are truly at the brink. We cannot afford to see any more people at this point. We have to do what we can to keep our numbers down. And unfortunately, that means that we just cannot reopen to the extent that I know so many people want to. And that's just the reality of where we are, because it is just so life and death right now.
All right. Dr. Nicole Van Groningen, thank you.
Thank you.